What are the three key slices in temporal bone, CT? Recall that the major anatomic parts of the temporal bone are the external auditory canal, the middle ear and mastoids, the inner ear, the petrous apex and the facial nerve. Let's take a look at these three. In this coronal view, we take note of two landmarks: first, the tympanic membrane, and second, the dense structure here medially called the otic capsule or the bony labyrinth. These create the borders of the outer, middle ear and inner ear. Focusing in the middle ear, we can see that the bones create a right angle. This is a key slice showing us the ossicular right angle. The ossicular right angle is seen in this coronal view and is formed by the lenticular process and the long process of the incus. Before moving on to the next key slices, recall the structure attached to the malleus neck. It is called the tensor tympani. When the tensor tympani contracts, it pulls the malleus, which is attached to the tympanic membrane. The tympanic membrane is tense, it is less able to vibrate. In this way, it protects the ear by dampening sound transmission. When we take an axial slice through the epitympanum, we see the malleus head atop the incus body and short process. This is a key slice to remember to find the ice cream on a cone sign. When we take another axial slice through the mesotympanum, we will see the two parallel lines sign. These parallel structures are pointed by the arrows. The more anterior line is formed by the tensor tympani going towards the malleus. The posterior line is formed by the incus lenticular process and incudostopedial junction. To review, we use the coronal view to see the ossicular right angle, the axial view to check the ice cream cone sign and to check the two parallel lines. These are the three key slices, because they are critical to identify the abnormalities in the ossicular chain. For example, the most common ossicular erosion is the incus long process, therefore we need to check it in the coronal plane. Another example is when there is loss of the cone in the ice cream cone sign, we can identify that the incus body is missing. And third, if there is loss of the posterior parallel line in the axial view, we can identify that the incus lenticular process is missing.